Okay. Remember in elementary school all the students lining up at the nurse's office when we were supposed to be enjoying gym? The nurse would ask us all to touch our toes and examine our back. We didn't really know the purpose then, but she was actually seeing if we had abnormal curvature to our spine, which is the definition of scoliosis. Scoliosis usually does not get very severe and is very adaptable, but we will go in detail on the different types, risk factors, and how to control it if it gets progressively severe. I am subjective to giving this speech and knowledge that I've had scoliosis since elementary school. I've done plenty of research over the years, and I know first person how scoliosis affects you and the people around you. Scoliosis is a disease that affects the spine and has multiple types. Scoliosis is defined as the abnormal curvature of the spine that normally happens during growth spurts. Normally, scoliosis is very mild and does not affect everyday life. There are 3 types of scoliosis. There's infantile scoliosis, from birth to 3 years old. There's juvenile scoliosis, from 3 to 9 years old. And the most common is adolescent scoliosis from 10 to 18 years old, which is when the majority of your growth spurts occur. Sometimes the spine curve can even look like an S or even a C, depending on the severity of the curve. The spine is measured in degrees, which gives the doctor an idea of the severity also. Now that we've looked at the definition of scoliosis and the types, we will go further in depth on how doctors find the scoliosis and how they treat it. Doctors use different methods to treat different severities of scoliosis. When scoliosis is first discovered during a physical examination, they will go further in depth and obtain an X-ray. If the scoliosis is not a threat to progression, doctors will normally get an X-ray with the yearly physical examination to ensure progression isn't occurring. When doctors are alerted and fear that progression will occur or has occurred, doctors will then ask the patient to be fitted for a back brace. The back brace helps urge the spine to grow straight instead of curved. 25 degrees to 40 degrees is usually when the patient will be fitted for a brace, and if their bones are still maturing and they have 2 years of growth remaining, they are subjective to being fitted for the brace. Sometimes the braces do not help, or it's too late for the brace to help. Once organs start to be affected by the curvature of the spine, surgery is the last option. Depending on the severity of the spine, the surgeon will place rods and pins to secure the spine in a less of a degree of an angle. And to ensure the organs will not be damaged from the curvature, sometimes multiple surgeries are required. So we know how scoliosis is treated, but what actually causes scoliosis? The causes of scoliosis are still a little foggy and are completely definite yet. The most common types of scoliosis are thought to be hereditary and passed on through generations. Some think that even the posture could affect the way your spine grows, so maybe your parents always telling you to sit up straight decreased your chances of scoliosis. There's also uncommon forms of scoliosis which are believed to be caused by neuromuscular conditions such as cerebral palsy or muscular dystrophy, birth defects affecting the development of the bones of the spine, and injuries or infection of the spine. So I encourage everyone to be examined for scoliosis and to get your children examined. Today we've learned about the disease scoliosis, and we looked what scoliosis actually is and how it is treated, the different types, and the causes. One final thought: even if you are diagnosed with scoliosis, you can still live perfectly normal life. Technology is tremendous and helps with most procedures and treatments, making scoliosis very adaptable. So some of my questions for the speech when I give my formal version is if I should include why I'm subjective to giving this speech, and I want to ask if my transitions are okay, and if I should memorize it maybe. And I also, when I do give this speech, I will have my visual aids. Thank you.